Human cytomegalovirus, also known as CMV or Hcmv, may be found throughout the body, but infections are frequently associated with the salivary glands. Infection is typically unnoticed in healthy people, but can be life-threatening for the immunocompromised, such as HIV-infected persons, organ transplant recipients, or newborn infants. After infection, Hcmv has an ability to remain latent within the body over long periods. Eventually, it may cause other possible malignancies or even death. Hcmv is found throughout geographic locations and socioeconomic groups, and infects between 50 and 80% of adults in the United States, which is much higher than the 40% it infects worldwide. These numbers are indicated by the presence of antibodies in much of the general population. It is not necessarily age-dependent, but elderly people may suffer more disease due to the fact their immune system is much lower. Most healthy people who are infected by Hcmv after birth have no symptoms. Some develop a syndrome similar to infectious mono or glandular fever, with prolonged fever and a mild hepatitis. A sore throat is common. After infection, the virus remains latent in the body for the rest of a person's life. Overt diseases rarely occur unless immunity is suppressed either by drugs, infection, or old age. Infectious CMV may be shed in bodily fluids of any infected person and can be found in urine, saliva, blood, tears, semen, and breast milk. The shedding of this virus can occur intermittently without any detectable signs or symptoms. CMV infection can be demonstrated microscopically by the detections of intranuclear inclusion bodies. The inclusion bodies stain dark pink and are called owl's eye inclusion bodies. The transmission of this disease from person to person, as previously stated, can be through bodily fluids. It also can be transmitted sexually or through breast milk as mothers pass it on to their children. And it can also be transmitted through transplanted organs or blood transfusions. To prevent this disease, there's a vaccination, but subjects have contracted CMV infection despite vaccination. To diagnose this, you will need to look at the antibodies and see what they say about the CMV virus. For best diagnostic results, laboratory tests for CMV antibodies should be performed using paired serum samples. This disease should be suspected if a patient has symptoms of infectious mono but negative tests for mono, or signs of hepatitis but negative results for hepatitis A, B, or C. Treatment for this can be used through an antiviral agent and has been shown to reduce the risk of CMV-related disease and death. It also provides a measurable long-term survival benefit. It also produces minimal treatment-related side effects and adverse events. These are my references where I got my information through studies and scholarly articles. Thank you for listening to my public service announcement. Stay healthy.